Hi, how are you doing today?
Hi, I'm good. How are you?
I'm good. Will you please verify your name and date of birth?
Catherine Maxey, 6/26, 1980.
Okay, we're going to talk about the colonoscopy today. I know you have one scheduled, so we're just going to talk about the procedure, some risk factors. Is that okay with you?
Yes, perfect.
So, risk factor is age over 50. But you're not over 50 yet, but I do see in your chart that colorectal cancer runs in your family.
Yes, my parents and my grandparents.
Okay, so that's a good indicator of why you're coming in, because you want to get checked and making sure that nothing is going on with you.
Exactly.
And a big race is African Americans have highest cancer rates. I know you're not African American, but that is a good thing to know.
Okay.
High intake of red meat and processed meats. Do you eat a lot of hot dogs, lunch meats?
I do like hot dogs.
That's okay.
Yeah, turkey sandwiches.
That's okay. So that's why we're getting you checked to make sure that nothing is affecting you.
Okay.
Do you work out?
Yeah, I try and stay active about 3 days a week.
Okay, awesome. Because obesity and physical inactivity is a big risk factor for colorectal cancer. But it's good that you're working out because we don't want you to get obese, and then that's a higher indicator. Do you smoke, have a heavy alcohol intake?
I don't smoke, just socially drink.
Okay, good. Because smoking and heavy alcohol consumption is a big risk factor. So we're going to talk about just the indication of why you're getting this procedure, what it's like, what they're going to do with the findings if they find anything during the procedure. So they're completing this procedure to really visualize what's going inside of your stomach, and they're taking a scope. It's going to enter your anus and go through visualizing your rectum and the sigmoid, descending, transverse, and ascending colon.
Okay.
So this procedure is able to diagnose if you have IBS, which is inflammatory bowel disease. Have you ever heard of that?
Yes.
Okay. And then polyps, tumors, diverticulosis, and it's just going to dilate the structure so it gives a better idea for the doctors.
Okay.
So if they do find something, they are able to take the polyps and send them to lab to determine if they are cancerous or not.
Okay.
Do you have any questions?
So I know you said they go in through the anus.
Yes.
So how do I need to prepare for this?
So this is probably going to take 2 days off of work if you're allowed to.
Okay.
So pre-bowel prep, you're going to be taking a laxative, so you're probably going to be on the toilet all day. So that's why they kind of ask you to take off work so that you're not having to really worry about something else when you're trying to get
Okay, do you have this written down anywhere?
Yes, for sure. So I'm going to send you with a handout home.
Okay.
So it's a colonoscopy fact sheet. It talks about what is the colonoscopy, the prep, the day of, and after.
Perfect.
So here's a picture of it. We're going to give you a physical piece when you check out.
Okay.
But this just kind of gives you a better idea of what's going to happen.
Okay.
So...
And afterwards, am I allowed to eat and drink right after the procedure?
Yeah, so depending on like the complications of what happens, so you could have a complication of perforation through the structure. So if you're having any pain, please notify the provider.
Okay.
Or any hemorrhage, so that's bleeding, just notify the provider immediately of severe bleeding, but we're just going to have you resume normal diet unless something else is found. We're going to ask you to increase your fluid intake so that you're able to get back hydrated, because you haven't drank or ate anything since the midnight before, and the day before you're not really eating anything either.
Okay.
And then we also ask that you have someone take you to the procedure and home. Just we don't want you driving or operating any machinery, just 12 to 18 hours after.
Okay.
For sure. Do you have any other questions about the procedure?
Sounds so fun. I can't wait.
We're all hoping that it goes well, and we'll see you on the procedure date.
Thank you so much.
Of course.